Good evening, everybody. Welcome. Sorry, we don't have programs tonight, but
This one
the
thing.
next program will be December
Always think
13th, as expected, but there's been a change of speakers. Dr. Pam
Yeah,
can't
perfect.
be here because she has some kind of school thing for her kids, so she'll be here later in March. And we're going to have Dr. Joe Cook, who is the new chief of medicine at New York Presbyterian Queens, my boss actually, and who is a Queens guy, who is now the chief of medicine there, and he's super, and he's going to talk about lung disease. But tonight, we all want you to smile. If you don't smile, we have cards. Dr. Rubin, Dr. Marsha Rubin, is the new chief of dental surgery at NYPQ. She runs a very large residency program. It's located in the same building as the Cardiac Rehab Center, some of you may be familiar with. And she's here to talk about dental health, and the title is the aging of dentistry. And we're going to find out about what happens to our mouths after we get all the fillings taken out when we get older.
Good evening, everyone. Thank you. Do you think I need the mic? I know I was told to use it, but am I good? Am I good without? Okay. I feel like it's the same. Okay. Good. Because I don't think I can do too much with my hands.
Isn't like pulling teeth, don't worry.
Right. Good. So again, thank you all for having me this evening. I'm going to cover a bunch of topics, maybe too many. I'm going to try to touch on everything I know about dentistry, or almost everything. If there's any questions in between, maybe we'll wait till the topic is finished and then you can go ask me, or at the end we'll play it by ear. So I don't know if any of you know, or you probably do, New York Presbyterian Hospital took over New York Hospital Queens, and with that, in efforts to collaborate, New York Hospital Queens recruited some faculty and staff and so forth to Queens, and that's how I came to be here. We have two residency programs. We have we have two at Cornell, we have two at Queens, and I'm trying to collaborate all of them. So just a little bit about the program. Excuse me, I'm sorry. This is moving ahead of me before I allowed it to. So we have two residency programs. They're ADA approved. We have a general practice residency, and we have an oral pathology program. We have 17 residents in one, 6 in the other. The dental clinic's open 5 days a week, 3 evenings, twice on weekends. We also have a suite in the emergency room, and it's open 24/7 for emergency care. And we see about 18,000 patients a year, which is quite a lot. The curriculum of the general practice, I'm not going to read all of this. It's very, very thorough, very inclusive. The residents are embedded in every aspect of dentistry, including hospital organization and research methodology, and they get instruction in all the disciplines through seminars, lectures, programs, and clinical management. And the education objectives of the general practice residency is like any other residency program. You're developing a methodology of appropriate treatment planning for patients in complex cases, increasing their speed and confidence, learning to assess and manage dental emergencies more efficiently, becoming competent in medical assessment, and understanding the requirements of the special patient and be able to provide their dental needs. And I get asked this question a lot: what's a special patient? Aren't we all special? I think we are, but special patients really mean the frail elderly, the medically complex patients with very involved systemic diseases, and the developmentally disabled. They rotate throughout the hospital through the dental ER, main ER, simulation lab, anesthesia, oral path, radiology, radiation oncology, medicine, and I also started them to have rotations at Cornell. We are a level 1 trauma center, and we see about 50 major trauma, maxillofacial trauma cases a year. So just to show you pictures of kinds of cases that we see, this isn't really trauma. Patients that had a motor vehicle accident, fractured 4 of her teeth, restored, On the bottom here, simple cavities that are restored, or very large cavities that are restored. We also see patients that are missing some teeth, totally missing teeth, have poor fitting dentures, and that have implants or will get implants. Someone who hasn't been to the dentist in a very long time, missing bottom teeth, so the whole top segment basically extruded, more implants, and a happy patient with dentures. Also, patients, this is pictures of patients with systemic disease, severe systemic disease, with severe gingival hyperplasia. Their gums are all blown up and swollen. Someone who has mucosal diseases and ulcerations. This person has a hereditary defect of the enamel, where the enamel is very thin and soft. It's called amelogenesis imperfecta. And here, someone who has an extra tooth, a supernumerary tooth. So, I get asked questions all the time from my patients, from my family, from my colleagues. Isn't tooth loss inevitable in later years? At my age, why should I bother with oral hygiene, such as brushing and flossing? Should adults be concerned about cavities? I understand that gum disease is a major cause of tooth loss in adults. Is there anything I can do about it? My dentures don't feel as comfortable as they once did. Should I try some different products? Now that I have full dentures, do I really need to see the dentist as often as before? Do I need to eat the same amount of or variety of food that I did when I was younger? I'm anxious about dental visits. I know I should go, but I can't. What can I do? I'm currently taking medication that my physician prescribed for me. Can this affect my dental treatment? I've heard about implants as an alternative to dentures. What should I know about implants? What is dentistry going to do to better serve older adults? Why do my teeth seem darker? Why does my mouth feel dry? Why am I losing my sense of taste? I'm assuming that many of you asked these questions, or maybe not. I'm going to try to pick and choose some of the most common questions. So, dry mouth. This poor tongue is very, very dry. Having a dry mouth can be irritating. It makes it difficult to eat, speak, and sometimes can even lead to some nausea. But one of the biggest problems with having a dry mouth is the toll it can take on your oral health. Dry mouth can promote gum disease and tooth decay. So, what could be the reasons for dry mouth? Well, the easiest answer is you can be dehydrated. We all know you have to drink, or you're supposed to drink, 8 ounces of water every day, which is about a glass. 8 ounces is a glass, so about 8 of those. Staying hydrated is not only good for your oral health, but for your physical health. What about smoking? Smoking, when you smoke tobacco, you limit the amount of saliva that the mouth can make, and this can aggravate the dry mouth. Certain medications can cause dry mouth. Thousands and thousands of medications have the side effect of dry mouth. Those that treat anxiety, depression, acne problems, diarrhea, a variety of cardiac medications can cause it, and they have the potential for increasing the dry mouth, which is a very common side effect. Infections and diseases could be the culprit. You may have an infection or suffer from a particular disease and then experience dry mouth, like Alzheimer's disease, diabetes, stroke, cystic fibrosis, anemia, and other diseases. Nerve damage. If you had some sort of surgery or an injury, then you may have difficulty producing saliva in your mouth. And breathing with your mouth open, which is very, very common. Your body's designed to inhale oxygen through your nose, and that's where the air gets filtered. When you breathe through your mouth, you're more likely to experience dry mouth. And side effects from certain medical treatments can cause this condition. Patients that get chemo or radiation experience sometimes very dry mouth. So dry mouth can prevent your mouth from producing saliva. Saliva is needed to fight bacteria and keep your gums and teeth healthy. Now let's talk a little bit about staining teeth. Also, something very, very common that I get questions about, why are my teeth stained? Well, there's two types of staining. There's extrinsic staining and there's intrinsic staining. Extrinsic is the outer layer gets stained from coffee, wine, cola, some people like curry, that's very staining. So smoking very much can cause extrinsic staining. And intrinsic staining is when the inner structure of the tooth, the dentin, darkens and gets a yellow tint. So what would cause intrinsic staining? As a baby or a very young child, too much fluoride could cause it. Or your mother might have taken tetracycline during the second half of her pregnancy. Or you took antibiotics, mostly tetracycline, early under age 8 years. You might have had trauma in your baby teeth or your permanent tooth, or you were born with a rare condition, which is called dentinogenesis imperfecta, which can cause gray, amber, or purple discolorations of the teeth. Staining is age-related, which is a combination of extrinsic and intrinsic staining, and the symptoms are basically the stain. It could be a white spot, it could be brown spots, yellow spots. Many times the dentin is showing through, and that's what's causing the stain. So some tooth discoloration can be removed with cleanings, like coffee, red wine, but some are more permanent, and sometimes bleaching is needed to take out the stain, or sometimes it's so severe that you need a crown or veneer. So many extrinsic stains caused by food and drink can be removed by regular professional cleanings and good home care. Good home care includes brushing, flossing, and rinsing after meals. Discoloration often can be removed by applying bleaching agents that you can get from the dentist or over the counter. And darkened teeth after root canals can possibly be treated with internal bleaching or veneers or crowns. So prevention, as with anything else, brush your teeth, preferably after meals, rinse your mouth with water after having coffee, red wine, or any of those, if you drink a lot of dark sodas. I always tell my patients, you have your cup of coffee, have a glass of water right next to it. If you don't want to drink the water, rinse with it. But you need the water anyway, so drink it. Intrinsic stains that are caused by damage to a nerve or blood vessel in the tooth sometimes can be prevented. Sometimes elective root canals are done to prevent that from happening. However, teeth that have root canals treatments may darken anyway. You should avoid too much exposure, early exposure to fluorides, but that's really only with very, very young children. Once the enamels form, fluoride won't discolor the teeth. So tooth discoloration is really just a cosmetic problem. However, if you have a child or a grandchild and you notice all of a sudden a dark tooth, you should immediately bring them to your dentist. Let's talk a little bit more about dental health. Research has proven that there is an association between gum disease and cardiovascular problems. Bacteria in the mouth, which are associated with gum disease, may be linked to heart disease, artery blockages, and stroke. Bacteria that cause gum disease can be a contributing factor in bacterial pneumonia. Pregnant women who have gum disease may be at increased risk for preterm delivery and could have low birth weight babies. And diabetics tend to have periodontal disease more than the general population, which makes it difficult for them to control their blood sugar. So researchers suspect that the bacteria and inflammation associated with gum disease plays a vital role in systemic problems. Prevention of periodontal disease is key in maintaining overall health. Again, brush your teeth twice a day. Use a toothpaste with fluoride to help prevent tooth decay. Clean thoroughly between teeth daily with floss or some interdental cleaner. And if you need extra help controlling plaque, use an antimicrobial mouth rinse. And make sure there's the ADA seal on your toothpastes and rinses. How do we prevent periodontal disease? Professional cleanings, see? Or eating a well-balanced diet, limiting snacks. So let's talk a little bit about plaque. All this right here. And then here's the gingival inflammation. The thin, sticky film that constantly forms on teeth when eating sugary foods. Bacteria in the plaque produce acids that attack the enamel. So the stickiness of plaque keeps the acids on the teeth, and this starts the process of tooth decay. So not only does plaque inflame the gums, but it eats away at the teeth as well. And the process of gum disease or periodontal disease is basically that it's an infection of the gums that can destroy bone and other tissues supporting the teeth. Here on the top, there's just some inflammation, it progresses, and then the bone starts to deteriorate, and then there is recession and pocketing. Plaque builds up on the teeth. If not removed, gums may become red or swollen and may bleed. In time, the gums can separate from the teeth, and deep spaces called pockets will form. The bacteria then collect in the pockets, and their toxins cause inflammation of the gums, which can destroy the bone that anchors the teeth. If left untreated, teeth will become loose and possibly fall out, or they'll need to be extracted. So again, with proper diet, brushing, the body functions much better and is more resistant to infection. And children, as we know, who don't have a proper diet, their teeth won't develop properly. So eating from the 5 food groups, muy importante. Any questions? I'm going to start now with some more serious stuff about bisphosphonates. Yeah.
Are there any foods or drinks that are beneficial for gums, avoiding gum disease?
Well, water is the best. Water, drinking the water, as I said before, not only for your oral health, but for your physical health, is the best. You know, drinking green tea, drinking some juices, they're all healthy, but in moderation. Water is really the best thing to drink.
Have you heard anything about pomegranate juice?
It's very healthy.
Unsweetened.
Yeah, no, it's great.
Yeah.
But there's natural sugars
Still has
in
a
it.
lot of sugar.
Yeah.
A lot of
Oh,
sugar.
no, the pomegranate juice that has nothing added to it.
But there's fructose, there's natural sugars.
Doesn't matter.
And that's healthy.
Doesn't taste sweet.
That's, right,
30
but it
grams of
still
sugar
has natural
has a lot of
sugars.
sugar.
And if you drank pomegranate juice and you didn't drink any water, and let's say you didn't brush your teeth, you would develop a lot of cavities. So water is key. You can drink pomegranate juice, but drink your 8 ounces of water, 8 glasses, excuse me, of water.
You know how you had the frame up there of the 4 progressions of gum?
Perio, yeah.
And you know how it looked like the buildup of plaque was starting to eat away at the tooth?
Right.
And then I was wondering, you know, how, once bacteria gets up under the gum, how does one get in there to release it?
So the dentist
Repeat
will,
the question.
oh, do you want me to repeat it?
Oh.
So the question was, when you have the progression of periodontal disease, which is gum disease, where it progresses, where the debris, the plaque, the tartar gets down into the gums and eats away at the bone and gets into the pockets, how do you clean it out? How do you get it out? And so there are treatments to remove it. First, a good debridement. If anyone's heard the term scaling and root planing, literally scraping it away. And then what happens is the gum reattaches to the root.
So when
Sometimes though, however, if there's enough bone loss, there are grafting procedures that can be done to build up the bone.
So if one were to go in for just a basic cleaning, and they use the tools that they use just for the cleaning, does that also go under the gum? Or?
It goes only to a certain level.
Oh, okay.
Yeah, usually if you have really bad periodontal disease, you will need scaling and root planing, or sometimes there's gum surgery, where they open up and really clean it out well. Yeah. Yes.
Is there a relationship between hepatitis C and tooth decay?
Not directly, not to my knowledge. Have you heard otherwise?
Yes,
What have you heard? Just that there's a direct correlation?
just about, yeah.
And what is the correlation? I'd like to know myself.
How does it work?
Yeah, what's the mechanism?
I'll have to look up Google.
Yeah, let me know. I'll look it up too. I have no, on a different level possibly, but not directly. Any other questions?
Simple question, does adding milk to your coffee decrease the chance of staining?
No. Yeah, I love coffee too, but I limit my coffee and I always drink water right after it. Yeah, because I've noticed on myself, actually tea is worse than coffee, by the way. Yeah,
All teas or?
all teas. Green tea is actually all teas, but I've noticed a lot of people like green tea, so I happen to notice that more. I like green tea, and I notice when I drink more of it, I get more staining as well. Yeah, so I know it personally, and I see it on my patients. It's very healthy, a lot of antioxidants, great, very tasty. Just have that glass of water right next to it, or carry that bottle. It makes a big difference.
So it was recommended to me that to avoid high acidic foods and beverages, and that if you're going to drink something like orange juice or tea or something like that, it might be better to use a straw as opposed to like sort of high pests
Right.
or teeth.
That's a good idea. Yeah, I agree with that. It is good to drink with a straw, certain beverages, especially people that are addicted to like Coke or whatever soda they drink, or Gatorade, or whatever juices they drink. I tell them that as well. Yeah. Or please don't have that at your bedside. Only have water at your bedside. Because at night, your mouth is significantly drier than during the daytime. So if you have anything which has potentially sugar or has some staining, then it will stain more.
Why don't all patients demand of their dentist that every one of the teeth be as white can be?
Let me repeat the question to make sure I got that right. So why don't patients demand that their teeth be as white can be?
Yes. White as a sheet.
Well, I don't
To look
know.
like Hollywood actors.
Well, I think that's an individual preference. I think not everybody wants white teeth. For those that do want white teeth, it's not always possible to have white teeth because the underlayer of the tooth, which is the dentin, is a yellow color. And as we age, the dentin gets yellower. And as we age, the enamel gets thinner. So you're going to have a little bit yellower teeth as you get older, and bleaching, even bleaching, can't correct that. Crowns can't correct that. Veneers can't correct that. But bleaching alone can only get it to a certain level. So, and I don't think very white teeth look so good. Do you? I think it looks too fake. Yeah, it's like chiclet looking. I don't like it. No.
32 chiclets.
Yeah. So a little brightness is nice, but I think natural is much better. So once you keep your teeth clean and there's not too much staining, that in itself is beautiful.
Get chiclet implants.
I'm going to move on and talk a little bit about bisphosphonates now. Bisphosphonates, I will not assume if anyone's on it, but it's a very popular medication. And bisphosphonates are a class of drugs that are used to prevent bone loss demineralization. They started out in the 1970s, but now with technological advances, the frequency of dosage is much less and they're stronger. Some of these drugs, in case you don't recognize the name bisphosphonate, could be Actinol, Fosamax, Zometa, Boniva. And some of them can be taken by mouth once a week or once a month, and some of them must be given in a hospital setting or a clinic setting because they're given intravenously. So what conditions are bisphosphonates prescribed to treat? Osteoporosis, the loss of bone density often seen in postmenopausal women. Hypercalcemia of malignancy, where there's an increase in calcium in the blood, from bone breakdown. And this is typically seen in patients that have breast cancer, lung cancer, or multiple myeloma. And metastatic disease to the bone, where there's cancer spreading to the bone tissue. Are there side effects to my mouth from taking these drugs? Absolutely yes. There is an important but rare side effect. A number of years ago, doctors began reporting cases of individuals having difficulty healing after undergoing tooth extraction or some sort of invasive surgical procedure. The phenomenon was called osteonecrosis of the jaw. The only common factor was that these patients were taking bisphosphonate medication. As a consequence, most doctors agree that there is an association between osteonecrosis of the jaw and bisphosphonates, although the drugs are not the only factors that come into play. We call it BRONJ, bisphosphonate-related osteonecrosis of the jaws, and it's a condition found in patients who have received intravenous and oral forms of bisphosphonate therapy for various bone ailments. It manifests as exposed, non-vital bone involving the maxillofacial structures. BRONJ is thought to be caused by trauma to dentoalveolar structures that have a limited capacity for bone healing because of the bisphosphonate therapy. Now this is very, very similar to ORN, osteoradionecrosis of the jaw. This is a condition of non-vital bone in a site of radiation injury. ORN can be spontaneous, but it's commonly a result of tissue injury, and there's an absence of reserve reparative capacity as a result of the radiation injury. They look very, very similar, almost identical. Both ORN and BRONJ, the mandible, our lower jaw, is more predisposed to this condition than the rest of the skeleton because of the high metabolism, and also because breaches in the thin oral mucosa in the dentition. Bacteria is readily available and can get right in there. Other anti-neoplastic medications and bone-targeting therapies can also cause jaw necrosis, like Prolia. I don't know if any of you have heard that medication. So this is, oh, it's a little bit light. Maybe if the light was off, but you can see an area over here, and that's just an area of exposed bone. Thank you. That looks a little better. So right here, behind the last molar.
What are we looking at, the jaw?
I'm sorry?
The jawbone?
The jawbone was just coming out. So how common is this problem? Well, there's about, since 2003, there's about 4,000 cases of BRONJ have been reported. So you're thinking, wow, that's a lot. Not really, because tens of millions of prescriptions have been written for these medications. So over 90% of these cases were also in patients receiving IV forms of the drug, not the oral form. So the overall risk is really less than 1% for the IV form, and 10 times less than that for the oral form. So it's a very, very small risk, but it's a risk that we need to communicate with patients because it's a very common medication that's been taken. If I take bisphosphonates, am I automatically at risk? Yes. Anyone who takes these medications has a chance of developing the condition. However, most reported cases occur after oral trauma, like a tooth extraction or some sort of surgical procedure. Now, smoking, taking steroids, or long-term use of these drugs, or taking multiple drugs, can increase the risk, along with diabetes, which can increase this condition. What kinds of treatment is available for osteonecrosis? Obviously, the best treatment is prevention, but if someone does develop these necrotic areas, antiseptic rinses do help, systemic antibiotics do help, and sometimes cleaning and removal of the dead bone can help, but very not aggressively, because it's been shown that aggressive cleaning of the bone causes it to be worse. Generally, therapy focuses on controlling pain and preventing infection so that the body can heal properly. Newer treatments are now available for both BRONJ, bisphosphonate-related osteonecrosis of the jaw, and ORN, which is osteoradionecrosis. Pentoxifylline is a medication that's used for vascular disorders. It's common in Europe and has been found to act against inflammatory mediators, and tocopherol, which is vitamin E. The two of them combined, vitamin E is a strong antioxidant. Both have been reported to promote healing by lowering blood viscosity and increasing tissue oxygen levels. I personally have used it in a couple of patients. I think I have seen some healing, not total healing of the areas, but I have seen some healing. So it's looking very positive.
So what form of vitamin E would you recommend? What form would you take it in?
They use the name tocopherol, and I believe it was 1,000 units, if I'm not mistaken. I'd have to look it up, the IU, International
So you're
Units.
saying-
And
There are
it's-
4 different-
Yeah, oh, it's in a pill, is that what you meant? Yeah, yeah. It's in a pill.
There's 4 different fractions to vitamin E. There's alpha, beta, gamma, and delta. And I think it's the gamma or the delta is very,
Potent?
very powerful, but it depends on the condition,
Right,
because you might need the alpha or whatever.
right.
But for cardio, the gamma and, either gamma or delta is the effective one.
Thank you. No, I learn something every day, I didn't know that, thank you. What can I do to avoid this condition if I'm taking bisphosphonates? Discuss with your dentist ways to minimize the risk of needing invasive procedure. This is so important. If you know that you're going to be on a bisphosphonate therapy, it's imperative that you go to your dentist, you get your cleaning, you get a checkup, you make sure everything's in order. Frequent professional cleanings, attention to home care, and please, careful observation of any changes in your mouth. Look in your mouth. See if something looks different or feels different. Attempt to preserve teeth as much as possible through root canal therapy or other conservative methods rather than extractions. And come up with an overall treatment plan for comprehensive and preventive care. The best scenario is one where dental work is planned and executed before bisphosphonate therapy starts. Is osteonecrosis always associated with dental procedures? No. Some patients have reported conditions being caused by irritating denture, eating a sharp food, or even spontaneously. Should I stop taking my bisphosphonates before dental procedures? Not without the advice or instruction of your physician. These drugs have been shown to be stored within the bones and slowly released over time. It's believed that even when not taking the medications, the drugs can persist for decades in the bone. There is no evidence that stopping the medication will reduce the risk of developing osteonecrosis of the jaw. The only reason to stop taking it is if your physician tells you to stop. And these are examples of what it looks like. So this is from an extraction, this is from an extraction, and this is from a few extractions. This is not from an extraction, just spontaneous, and this as well. But in a case like this, where the patient probably didn't have good teeth to start with, it was already like a chronic infection there, they developed it. Any questions?
It used to be the case, I think, that years ago, that if you were taking heart medications, that you had to take antibiotics before seeing the dentist. Is that related to this in any way? I think that stops now, I think.
It's not directly related to this. So the AHA, the American Heart Association, had changed their recommendations regarding patients with certain valvular issues, cardiac disease, but with valvular disease. And they changed their recommendations as far as when the antibiotics should be given before dental treatment. And basically, you still do give antibiotics, but for the severe forms of valvular disease. Someone, for example, with mitral valve prolapse, but is asymptomatic and there isn't regurgitation, they don't recommend. Even with low regurgitation, the AHA does not recommend giving antibiotics. But it really is at the discretion of your physician. If your physician or cardiologist says, take the antibiotics, you're going to take the
What is the
antibiotics.
purpose of the antibiotics?
To prevent a bacteremia from dental treatment to travel to the valve. So, you know, the mouth is a dirty place. Even when you brush your teeth, it's still dirty. There's lots of bacteria there. So bacteria can travel to the heart when you have dental treatment. However, bacteria can travel to your heart when you brush your teeth.
What's the pathway?
I'm sorry?
What is the pathway? How would
Through
it
the bloodstream.
Oh, if you have a crack in your gum, then the blood.
Anywhere. Yeah.
Because you would just imagine swallowing liquids goes through the esophagus, goes to the stomach.
Yeah. No, it's through the bloodstream. Yeah.
Because of porous something in the
Yeah.
mouth.
Yeah.
Oh, wow.
Also, is it the base of the tongue? Things can enter the bloodstream just
Oh, sublingual.
Well, the mouth has very thin mucosa.
Yeah.
The gum area is thin. Remember, there's no skin inside the mouth, so it's very thin. So breaches can occur very easily. Breaks, it can cut yourself very easily in there. So, and that's how bacteria travels.
And the same reason that does the same reason pertain to people who have prosthetic devices, medical devices that
Similar.
can be treated
Similar.
with
So-
antibiotics for the same reason?
Yeah, the risk of developing some sort of bacteremia from, for example, someone who has a knee replacement or a hip replacement and then not taking antibiotics is so much less than from a person developing a bacteremia from a valvular issue. Yet the regulations changed, and I can't remember how many years ago, where I call them the orthopods, the orthopedic surgeons, they made their decision to, that patients should be taking antibiotics before dental treatment. Previous
Sometimes
to
they
that,
just give
they
you a
didn't have a
single-
say on it because the risk was so low.
And sometimes they just give you a single dose, right?
Right, it is a
before the
single dose
procedure.
for both. For the cardiac as well, it's a single dose. It's not like it was 20, 25 years ago where I was giving IV antibiotics, I remember as a resident, to my patients, anyone who had valvular disease. We don't do that anymore, everything's oral, but it's just to protect you from developing a bacteremia that could affect the heart and develop endocarditis, which can be very severe. But with osteoarthritis necrosis or bronch, it's a different situation.
I have a question.
Yeah.
Are some people more prone to having problems with their mouths than others, even though they do good dental care?
Well, heredity plays a role, that's for sure. Environments, I'm sure, as well. There are some people that do have stronger teeth than others. The anatomy of it, better shape, thicker enamel, yeah.
Right, because there are some people who have great teeth and they say they hardly do any
They're
dental
blessed,
care.
yeah, they have good genes, yeah.
Tagging on to that, wasn't it found true that there's a certain bacteria that leads to cavities, and if someone doesn't actually have that bacteria, that the risk is much lower for getting, so it's hereditary, but then also what bacteria is in the mouth, right?
Right, well, there's a variety of bacteria
But
that's
like
in
one
that.
in particular that is.
Well, Streptococcus mutans is a typical bacteria that causes cavities. There's different ones that cause periodontal disease. You're right, some people, if you cultured everybody's mouth, I don't think we would all have the same degree of bacteria in them. So I'm sure that that's very, very true, that some people have lower levels of bacteria than other people. But that equates to any other disease process or infective type of process, so.
Thank you.
Oh, what about mouthwash? Would that do anything to the wallet for your dirty mouth?
It's a great adjunct.
Adjunct.
It's a great adjunct, absolutely. I tell people just be aware of those with a lot of alcohol in it. So Listerine gets great reviews, great advertisements where the person's like for a minute and then burst of fresh air. It is a good rinse, but there's a high degree of alcohol. I don't remember the percentage, I'm sorry. I don't even want to say a number because I don't remember it. But there's a lot of alcohol in there, so it does dry the mouth. I prefer rinses that don't have alcohol in it. So Crest makes good ones, Biotine makes good ones. And also, if you're prone to developing cavities, even if you're not a child, because adults do get cavities as well, fluoride rinses are really good too. So Act, Fluorogard. Listerine actually makes a fluoride rinse that doesn't have alcohol in it. So that one's good as well.
What's the other ingredient that they use to kill the bacteria then?
I'm sorry?
The non-alcohol ingredient, what is it?
What's in there?
No, you said alcohol is not preferred, so what's in there that's preferred?
There's other antimicrobial agents. There could be triclosan is one of them. Chlorhexidine in lower levels could be in some of them. There's a medication, it's a rinse called Paradex, which is chlorhexidine in a higher level. That's a prescription.
TOL maybe?
I'm sorry?
TOL?
Probably some have tea oil in it too. I'm sure there's a lot of other things that I don't know off the top of my head. But fluoride actually stannous fluoride also is an antimicrobial, so some of the fluoride rinses are also very good for that as well.
On that note, what is your?
Louder, please.
Oh, I'm sorry. What is your opinion about, there are different grades, different types of hydrogen peroxide. There's the kind you can get at Walgreens, 3% with stabilizers in it that I think are not recommended as much as the one that they call food grade, which is diluted for safety's sake. What is doctor's opinion on food grade 3% hydrogen peroxide as an antimicrobial?
They're both 3%?
Yes, but one is like cleaner. One is less stabilizers and
So
pure.
I don't like hydrogen peroxide in general as a mouth rinse alone. It actually works very, very well.
Yeah.
And actually, if you mix it with a little povidone and with a little water, it's a great antimicrobial and it helps halitosis tremendously. But it does cause sloughing of the gums.
Oh.
So I don't like when people use it too much because then they're too aggressive and then they really can cause a mucositis, which is really like the whole layer of the gum can slough off.
Wow.
So I don't like that, but it is, if you use it very carefully and not that often, it's very good.
What about half a cup of water, half a cup of hydrogen peroxide?
That's
It
better.
does a great job when
It
I feel a
does.
cold coming on. Yeah.
Right, and add a little povidone to that, a couple of drops.
What was povidone?
Like iodine, yeah.
Red?
You don't wanna
Betadine,
swallow
yeah,
It's
just a
like-
couple drops.
it. You don't want to swallow it.
No, you don't want to swallow it, but it works really well.
And you recommended Crest, but Crest comes in a very solid blue, like solid.
Yeah, your teeth
blue.
won't turn blue from that.
Isn't that not ideal to be taking in food coloring like that?
It doesn't really have any effect.
Oh, okay.
Yeah, I haven't seen any studies where there's any detrimental effects from the Crest rinse.
Why don't all toothpaste manufacturers strive to obtain the ADA rating?
That's a good question, and I guess it's very expensive, and that's probably why they don't do it. And very
Colgate has it,
time-consuming.
Crest does not.
Yeah, but Colgate's been in existence for how long? Crest has it,
Crest has it?
yeah.
Oh.
Crest and Colgate are the top two. Yeah. Yes.
How about just using like a salt water, with basis for the purpose of destroying the germs, hopefully, and for keeping down any possible swelling and as a disinfectant and stuff like that.
So salt water is really a palliative type of thing. It makes you feel better. It really has no medicinal therapeutic action. I know many of you probably have been told rinse with a little salt water. It does make it feel better, but it doesn't really do anything.
Wow.
Not the germicide or anything like that? Oh, okay. That's good to know. Thank you.
You're welcome. Any other questions? I'm going to move on. Oh, go ahead.
What about use of the water pick?
It's a great adjunct, but you have to brush and floss. If you can't floss, then you can use the water pick instead for whatever reason. It definitely makes your mouth feel good and clean, but it's just an adjunct.
What's the best way to brush for your gums?
The best way is a soft toothbrush, number
Yeah, that's
one.
number one.
No medium or hard, soft only.
Yeah.
You angle your brush 45 degrees so that the top bristles get in the gum line. So if you're working on the top teeth, you angle it like that so it goes on the top. If you're working on the bottom teeth, angle it that way so that the bristles go, yeah. You want the bristles to get in the gum.
Then just circle around there?
Just up and down or circle,
Yeah.
whichever work. And set the timer. Work on a couple of teeth at, 10 seconds, then move on. It's not 1, 2, 3. I also
Yeah,
recommend
I know,
electric
I know.
toothbrushes.
What? What do you say about electric toothbrush?
That they're better. Electric toothbrushes do a more efficient job than manual toothbrushes. So Sonicare, Braun, Oral-B, they're all great. I would recommend them. They're definitely more efficient. So let's talk on a lighter note about teeth whitening. So this person has lovely teeth, but the top are a little yellower and the bottom look nice and bright. So to answer your question, she wanted really nice white teeth, and there you are. She has beautiful white teeth.
The other one drinks tea and wine.
Right? So what's tooth whitening? Bleaching your teeth changes the color of the tooth enamel and removes tooth surface stains and those deeper in the teeth. Your dentist can bleach your teeth at the office, or they can dispense to you a material and make you a special guard that you can wear at home, or you can buy over-the-counter material, or they're even whitening toothpastes, but beware, they're also more abrasive, and they do scrape the stains off, but long-term they can be quite abrasive to the teeth. So here are some photos of bleaching. This is power bleaching. This is a method that the dentist applies a light-activated bleaching gel. It causes the teeth to get significantly whiter. It takes about 45 minutes, maybe a little longer, and usually you have to do 3 cycles minimum. Several follow-up appointments are needed, and sometimes the dentist will also give you the take-home bleaching trays along with this. I personally think just the take-home bleach is great because people tend to be less sensitive this way. You can get strong bleach, or if you've got sensitive teeth, the dentist can give you a little bit lower level strength bleach. You wear these guards, maybe a half hour every day for about 10 days, and the teeth get a little lighter, sometimes drastically lighter.
And how long does that last?
I'll get to that.
And is
then
that
there is-
just for cosmetics, or does that?
Well, yeah, I'll get to that. And there's also the over-the-counter, where, I don't know if any of you have tried Crest strips, or there's various other, there could be like a CVS brand or a generic brand. They're basically strips embedded with a low-level bleach. Sometimes it comes with a special guard, but it doesn't fit quite as well as this kind, the kind that the dentist can make. And they work. They do work. Basically what they're doing is they're pulling out the stains that are embedded in the pores of the teeth. So they do work nicely. But if you have intrinsic staining, those deeper stains, it's not going to work. And if your enamel's already thin, because just with age it got thinner, or you abrade your teeth by brushing too hard, it's only going to work so far.
Does this work as well as natural teeth as in caps?
I'm sorry?
Does it work for natural teeth as well as caps?
Thank you. So the question is, does it also work on caps? No, bleaching only works on natural teeth. That's a good question. It will not bleach caps. Now, if your caps are very stained, it will pull out the stain, yes, but it won't do anything else, just pull out the stain.
So you end up with two-tone teeth or
Yeah.
crowns?
Yeah. Also, if you have white fillings, it's not going to bleach the fillings. It's only going to bleach the teeth, but it will pull out the stain, so it might appear lighter. So it won't lighten stains like tetracycline stains, which are intrinsic stains. In a case like that, your dentist might recommend veneers or crowns. And here's some bleaching. It can make drastic results in some patients. It really, really can. Let's talk a little bit about bonding. So this patient has a little space, some chipping. Bonding is the application of a tooth-colored composite resin. It's like a plastic type of material, and it repairs decayed, chipped, fractured, or discolored teeth. It can make them appear longer, or it can be a cosmetic alternative to amalgam fillings, which are very commonly put in the back of the mouth. This person has a moderately large space in the front, and I'm going to close the space. Same as this person. That seems to be a common complaint. People have spaces.
And can bonding be repaired
Yes.
after a period of time?
Absolutely. Yeah, bonding lasts only so long, just like teeth with wear and tear, but it can be repaired. And here's silver fillings that obviously is like, well, I see it, a little chip here, there might be decay under it, so this was changed to white fillings.
Is it recommended to remove mercury cavities?
So amalgam fillings that have mercury in it. So if you have a healthy tooth that has a silver filling in it, and there's nothing wrong with it, and the radiographs, the x-rays don't show anything there, and clinically it looks solid, there's no reason to change it. But if there's decay under there or there's a break in there, it has to be removed. But we have high suction devices, and now we have amalgam scavengers, and the risk of having mercury in the air, and it's such a ridiculous risk. I just don't agree with any of what's exposed there in the news where they say no amalgam, no mercury fillings. They're good fillings, and if you have to take them out, you have to take them out. Let's talk a little bit about veneers and laminates. So in this example here, this person has a little chipping, a little staining, maybe some cavity or just staining here. A lot of different colors here, not happy with her smile. So veneers were done.
What exactly?
So veneers are thin pieces of porcelain or ceramic, not all porcelain, they're ceramic-like material, used to recreate the natural look of teeth while also providing strength and resilience comparable to enamel. It is often the material of choice for those looking to make slight positive alterations, position alterations, or to change tooth shape, size, and or color.
How long does that last?
It can be indefinitely. So what happens is a certain amount of the tooth is reduced, whether it's 1/4 of a millimeter, 1/2 millimeter, or a millimeter, depends on the situation. And the laminate is literally bonded on to the tooth. This is what the internal part of the laminate, see, it's like a little shell.
Does insurance pay for any of this stuff?
Did what?
Does insurance pay for,
I'll tell you that in a minute. So, this is just a schematic of what it looks like. This is the veneer, and it literally gets bonded onto the tooth. And here's a nice example of veneers. So veneers are, the term veneer, it's a cosmetic procedure.
like the whitening, for instance, does insurance pay for that?
No,
No.
So none of these things are paid for by
no.
insurance.
Whitening, it's cosmetic. Whitening is a cosmetic procedure, so it's not covered. Even if it has a psychological impact on the person, you can try to justify it, it's still a cosmetic
So what
procedure.
does insurance cover?
Well, I don't know what insurance covers, because there's hundreds of insurance companies or thousands of insurance companies.
So I realize that, but this is probably like a standard, but most, like, I would say most cover like x-rays, they cover, most cover,
I would, if I had to just take a guess on what an average good insurance company would cover, they'd cover 100% preventive, they'd cover 80% of routine, like restorative, which is fillings, maybe perio as well, 80%, root canals possibly 50%, crown and bridge probably 50%. But don't forget, dental insurance is not like medical insurance. Usually you have a maximum of $1,500 to $2,000 per year. So if you're going to need a root canal or a crown,
You got it right there.
And it's
Way
also
over.
it's
Yeah.
also 80% of their schedule, not the
Right.
dentist
Right.
charge.
if the dentist that you go to is a provider of insurance, yes, yes. So dental insurance is very, very different than medical insurance. It's like apples and oranges. You really can't
A
equate
lot
the
of
two.
times what you do is, if you have a husband and wife, so what you do is you double, you have a family plan.
Mhm.
So I guess you end up maybe $3,000 together.
Mhm. That's a good idea.
Yeah,
I guess some insurances will do that.
Yeah, I mean, well, they'll do a dental,
Mhm.
companies will do a dental, but a lot of times when it comes to medical, what's happening is now, is that companies, if your spouse works, then you can't put your spouse on the plan, you know what I mean? There are companies doing that with medical right now. It's starting to happen more and more, because of all the expenses, health insurance going up, and that's how some companies are trying to save a few dollars by having, if you're married and your family, your spouse works, so let's just you can only put yourself on it.
Right.
So how do people supposed to pay for these things? I mean, especially not rich people. I mean,
Right.
normal middle class people.
Difficulty.
With difficulty, but,
Payment plans.
there are It's a mostly women, but some men as well, have Botox. They go to the dermatologist, it's not covered, and they get it done. Same thing here, it's cosmetic.
They go into debt
Yeah.
now. They credit card.
Yeah. These are cosmetic procedures. Now, I'm gonna get to the next part, which is crowns and bridges, and those are not cosmetic procedures. That's usually because there's a fractured tooth or severely decayed tooth, and the person needs a crown. Insurance and good dental insurance generally will cover 50% of that. Maybe there are some out there that would cover 70 or 80%, I don't know. But remember, there's a maximum usually with dental insurance of $1,500 to $2,000. So there's always going to be an out-of-pocket expense.
So they cover dentures, but they don't cover implants.
Again, it all depends on your insurance. There are insurance companies that are starting to cover implants, and actually, it depends on what medical insurance you have. Sometimes the surgeon will bill the medical insurance for the surgical part of the implant.
Do you get many more requests for cosmetic dentistry from high school students than for older patients?
Not me. No, I mean, I do get from graduating high school students that, let's say, needed orthodontics and didn't get it done because it was too expensive, or the parents or the kid didn't want it, whatever the reason was, and they have spaces. So I do bonding. I wouldn't do veneers on a 17-year-old or an 18-year-old. But I get more commonly 20s, 30s, sometimes older, that they want veneers or bleaching. Is there a question on this side? I'm going to move on. So, crowns and bridges. This is a picture of a crown, and this is a picture of a bridge. A crown is basically a cap. It covers the entire tooth, a damaged tooth. A crown can also be placed on an implant to provide a tooth-like shape and structure. Bridges may be recommended if you're missing one or more teeth. Gaps left by missing teeth eventually cause the remaining teeth to shift and rotate, resulting in a bad bite. The imbalance caused by missing teeth can also lead to gum disease and sometimes even temporomandibular joint disorders. Root canals. It's a scary term. Everyone's afraid about root canals. They really are not that painful. The tooth could be painful initially, but the actual process is not that painful. A badly damaged or infected tooth needs to be repaired. The procedure involves removing the damaged area of the tooth, which is called the pulp or the nerve, cleaning it, disinfecting it, and then filling it with an inert substance, and then sealing it. The common causes affecting the pulp are a cracked tooth, a deep cavity, repeated dental treatments to the one tooth, or trauma. And the term root canal comes from cleaning of the canals inside the tooth's roots.
Can you just go back one?
Sure. Oh my. This one?
Yeah, just.
Yeah, so here, let me see if I can point. Here,